Hi, my name is Catherine Welder, but I go by Skeeter, and this is my PowerPoint on nuchal translucency ultrasound in the first trimester. So what is nuchal translucency ultrasound? So the nuchal translucency refers to the hypoechoic region located between the skin and the soft tissues behind the cervical spine in a fetus. So on your left, you can see a three-dimensional ultrasound image of a fetus with increased nuchal translucency, which we'll view other images in a minute. So nuchal translucency testing or screening was discovered in the 1990s as a novel approach to screen for aneuploidy. Nuchal translucency is detectable and can be measured in ultrasound form from a fetus gestational age of 10 weeks and 3 days to 13 weeks and 6 days. Enlarged or increased nuchal translucency is independently associated with increased risk for cardiovascular and chromosomal abnormalities. And these are associated with increased risk for miscarriage, fetal demise, and neonatal death. Finally, enlarged nuchal translucency may also be associated with developmental and genetic syndromes, which we can touch upon in a minute. Both the American College of Obstetricians and Gynecologists and the American Institute of Ultrasound Medicine recommend nuchal translucency screening as part of the standard first trimester screen for fetal aneuploidy, in particular Down syndrome. These guidelines state that ultrasound for genetic screening purposes should be offered to all pregnant women who seek prenatal care prior to week 22. This indicates that the procedure should be presented as a choice rather than a mandated test. NT screening is recommended to be used in conjunction with the maternal serum test, beta HCG, and pregnancy-associated plasma protein A, to estimate the total risk for Down syndrome. The discovery of this said combined screening, which is the nuchal translucency test and the maternal biochemistry markers in the first trimester, led to incredibly high detection rates of trisomy 21. Although trisomy 21, aka Down syndrome, is the most common aneuploidy associated with enlarged nuchal translucency, enlarged nuchal translucency is also associated with trisomy 13, which is Patau syndrome, trisomy 18, which is Edwards syndrome, monosomy X, which is Turner syndrome, and triploidy, which is also associated with enlarged nuchal translucency. So, how good is this test? When we're talking about detecting abnormalities of the neck, the Shannon Wall Women's Health, a primary care clinical guide, references that neck abnormalities in singleton pregnancies have the highest detection rate, which is around 92% by week 14. So when we're just doing nuchal translucency ultrasound alone, it can detect Down syndrome risk with about a 65 to 70% detection rate. It can detect other chromosomal abnormalities like the ones we referred to earlier about 50% of the time. And it can detect other genetic disorders and birth defects, particularly cardiac abnormalities, and a situation called cystic hygroma, which is a veno-lymphatic malformation at the back of the neck. When you combine nuchal translucency with these first trimester chemical biomarkers we referred to in the last slide, the detection rate for Down syndrome jumps up to around 87% with only a 5% false positive rate. So this is a better detection rate and a lower false positive rate than the second semester quadruple screen that can be offered to women. There are several methods of aneuploidy risk screening available to pregnant women in the first and second trimesters. Nuchal translucency screening is part of both the first trimester combined screening and the integrated screening tests you can see in the components section listed on the PowerPoint slide. So the first trimester combined test is a screening that's most appropriate for patients who place a high value on identifying Down syndrome during the first trimester and accept a higher risk of procedure-related pregnancy loss from first trimester invasive diagnostic testing. This test should only be offered if chorionic villus sampling, or CVS, is readily available for individuals who screen positive on this combined test. In the integrated screen, aneuploidy risk assessments are based on several maternal marker combinations, as well as the Nuchaltranslucency screening. For patients who can't decide whether or not to have a screening test or a diagnostic test as their initial test for Down syndrome, assessment of Nuchaltranslucency alone can help some of individuals, especially those at higher risk for aneuploidy, make their decision. In these cases, if the Nuchaltranslucency is normal, they may be comfortable choosing a non-invasive screening test, whereas if the Nuchaltranslucency is enlarged in the fetus, they may be more comfortable choosing to have an invasive diagnostic procedure for fetal microarrays since there is an increased risk of genetic abnormalities in these pregnancies. Measuring Nuchaltranslucency is like your standard ultrasound procedure. So the ultrasound can be done transvaginally or transabdominally, usually in a pregnant woman who's around 10 weeks gestational age. Transvaginal ultrasounds will provide more accurate images. So the baby's head will be pulled up on the ultrasound screen in order to obtain the Nuchaltranslucency measurement. So it's measured using the calipers provided on the screen, and then the measurement must be obtained at the widest space of the Nuchaltranslucency. Enlarged Nuchaltranslucency thresholds are usually at the 95th and 99th percentiles for gestational age, as measured by the crown rump length. The magnitude of enlarged Nuchaltranslucency is an important prognostic factor, which we'll get into when we talk about the interpretation of the testing. It is very important to note that some nuchal fluid is a normal finding in all first trimester fetuses and usually resolves spontaneously in the second trimester. So the results are calculated either with the maternal serum markers, if they've been done, or with a maternal age and fetal nasal bone on the ultrasound. So on this slide on the left, you can see a normal first trimester Nuchaltranslucency scan. So if you can see right here in the base of the picture, you'll see a little measurement with calipers. And you'll see that translucent area between what looks like the back of the fetus's neck and then the next white line is pretty thin. And if you go on to the right, you'll see an enlarged first trimester Nuchaltranslucency scan, where that space between the fetus's neck and the next layer is much larger. There are several advantages and disadvantages associated with first trimester screening, specifically with Nuchaltranslucency testing. So some advantages of this are that there can be a fairly early reduction of maternal anxiety with negative results. It's important, again, to remind you that this is a screening, not a diagnostic tool, but some people feel significant relief with getting a negative screen test. Early screening also provides an opportunity for first trimester prenatal diagnosis by chorionic villus sampling, whereas later screenings, one must undergo an amniocentesis. Detection rate is superior in the first trimester to the second trimester, and it reduces the need for invasive testing and its associated risks. It also allows for maximum time for decision-making and privacy if the parents or the mother choose to terminate the fetus and the pregnancy. And it also provides an opportunity for second trimester AFP screening and ultrasound screening options for neural tube disorders as well. Some disadvantages are that it's pretty difficult sometimes to accurately measure nuchal translucency, and being off by 1 millimeter changes the risk factor significantly for this screen. And so you need pretty stringent training and pretty formalized education on the sonographer's behalf. Sometimes it's difficult to obtain proper imaging so that you can adequately obtain a true measurement. Sometimes the fetal position and the maternal body habitus can make it an accurate nuchal translucency measurement impossible. Also, nuchal translucency measurements vary by week to week, so what would have been an abnormal nuchal translucency measurement could potentially look normal later on depending on the timing. And then identification of a fetus with Down syndrome that would have been spontaneously lost. So there is a decent around 15% rate of spontaneous loss between 11 and 16 weeks, and you're measuring nuchal translucency between 10 and 13. So there's a potential that you would be measuring and realize that a fetus is at an increased risk for, Down syndrome when the pregnancy would have been ultimately lost anyways. All right, so bear with me on this slide. There's a lot going on, but it's pretty straightforward. So there isn't an absolute threshold for what is termed as an enlarged nuchal translucency. However, generally accepted guidelines are greater than or equal to 3 millimeters, which will put you in the 95th percentile, or greater or equal to 3.5 millimeters, which will put you in the 99th percentile. The magnitude of enlarged nuchal translucency, again, is an important prognostic factor. So fetuses with nuchal translucency that measures 3.5 to 4.4, there's only a 70% chance of having a normal outcome for this pregnancy. And normal meaning non-aneuploidy, non-structural abnormalities, non-genetic abnormalities. And then you can see as nuchal translucency increases, that measurement, so 5.5 to 6.4, the chances of normal outcome decrease significantly. So this is only around 30% at this measurement. So nuchal translucency measures aneuploidy, structural abnormalities, genetic syndromes, twin-to-twin transfusion, and then again, like I said, in normal fetuses, there is a time where there is a measurable nuchal translucency, but it resolves spontaneously. So again, for aneuploidy risk, trisomy 21 is the most commonly associated with an enlarged nuchal translucency. And then again, the risk of Down syndrome is usually a calculation. So it's an equation that accounts for nuchal translucency thickness, maternal biochemical marker levels again, and maternal age. So increasing nuchal translucency above the 95th percentile for gestational age is associated with much increased likelihood of trisomy 21. So you can see the numbers below. And then increased nuchal translucency is also related to structural abnormalities of a fetus in 4 to 10% of all fetuses. It's usually an early marker of congenital cardiac abnormalities. And when there is a increased nuchal translucency on a fetus, there's a 3 times greater risk for that fetus having hydrocephalus, certain lung disorders, atresia and stenosis of the small intestine, osteodystrophies, and diaphragm abnormalities. Then for genetic syndromes, there's over 100 developmental and genetic syndromes associated with enlarged nuchal translucency. And then in twin-to-twin transfusions, enlarged nuchal translucency is predictive of twin-twin transfusion syndrome. And then again, like we said, in normal fetuses, you usually have a spontaneous resolution of increased nuchal translucency. However, persistence of this increased nuchal translucency is a marker for underlying abnormality and a poor prognostic indicator. So after a diagnosis of enlarged nuchal translucency, the post-diagnostic evaluation includes genetic counseling with options for fetal genetic testing. So if there's an enlarged nuchal translucency identified as part of just nuchal translucency testing alone, or the first trimester combined test, or the integrated test for aneuploidy, chorionic villus sampling, or amniocentesis should be offered for definitive genetic diagnosis. You can, however, offer a secondary screening test based on cell-free DNA. A negative screen reduces the proportion of patients going on to invasive testing by over 90%. A positive screen, however, still needs to be confirmed by invasive testing. So you need to address that the potential benefit of reducing the chances of false positive screen are there, but you have to emphasize that cell-free DNA is again not a diagnostic test. Some invasive testing can be offered to patients who have only undergone nuchal translucency testing and not the combined tests. However, there is not consensus around the optimum threshold that would cause a provider to counsel a patient to proceed directly to invasive testing. Some practices suggest that nuchal translucency thickness greater than 3 millimeters should indicate to a provider to immediately offer CVS to a patient. The other things that can be offered are a fetal anatomic survey, which can happen at the time of NT measurement, and then again at 18 to 22 weeks of gestation. And this is really sensitive for the diagnosis of congenital anomalies, especially the cardiac ones that we referred to. The survey should be repeated like is written at 18 to 22 weeks of gestation because it's more sensitive at that time. You can be offered a fetal echocardiography. This is really around decreasing fears and anxiety. And then there needs to be periodic assessment of fetal well-being because there's an increase of risk of fetal demise in fetuses with enlarged nuchal translucency, particularly if that translucency thickness is persistent. So the associated teaching and counseling with nuchal translucency testing or screening is really that the key point to take away is that these tests, or if you're doing nuchal translucency testing alone, is not diagnostic. Each test has associated false negatives and false positives. So if a patient wants to have a definitive diagnosis of aneuploidy, chronic villus sampling or amniocentesis are currently the only available options. Although this test is considered routine, like we discussed, a patient does not need to undergo nuchal translucency ultrasound, the first trimester screen, or the integrated screen. This is purely optional. Finally, if patients screen positive for these potential aneuploidy or structural abnormalities, they should be referred to genetic counseling. Genetic counselors will help determine the patient's absolute risk for having an aneuploidy child or one with structural abnormalities or one of the other genetic syndromes associated with increased nuchal translucency. They will also help discuss which genetic test would meet the patient's needs, and they would be able to offer ongoing support and guidance. Thank you again for listening, and if you have any questions, please feel free to reach out.